Right. Good morning, everyone. Mwazuka Bwanji. It's 8:30 sharp, so we are going to start. Welcome to our second session of our species-specific veterinary anesthesia in wildlife series. Last week, we covered reptiles, wild ruminants, and elephants. And today, we are going to look at lions and other carnivores, giraffes, and rhinos. My name is Sarah Malanga, and I'll be your host today. With me is Dr. Kirsten Neki, who is my co-host. So today we have three amazing speakers. To start with, we're going to start with Dr. Isaac Lekolool, who will talk about managing anesthesia in giraffe. Dr. Isaac Lekolool is a unique combination of leadership and practice. He is the Assistant Director of Kenya Wildlife Service. He is the paramount figure in Kenya's conservation effort. Dr. Isaac, we are so honored to have you share your expertise with us. But before I hand over to Dr. Isaac, let's look at the learning outcomes, the key learning outcomes. By the end of Dr. Isaac's talk, you should be able to understand the entire anesthesia process for a giraffe from induction to recovery. Secondly, you should be able to recognize the different administration modes and the principle for using general anesthesia and local anesthetic techniques. Thirdly, you should have knowledge of the critical steps for monitoring vital signs and the depth and managing common anesthetic complications in giraffes. Lastly, you should appreciate the unique species-specific need and consideration essential for the safe giraffe anesthesia. With these few remarks, Dr. Isaac, I'll hand over to you.
Yeah, thank you, Sarah, and good morning, all participants. Today we are going to talk about giraffe anesthesia. And as you've been told, my name is Isaac Lekolool from Kenya Wildlife Service, and I head the veterinary and capture services. Just to start us off, we'll talk about what giraffes are. Because there have been many stories about giraffes and different versions from all over the world. But the giraffe is it's a large African hoofed mammal that belongs to the genus Giraffe. It is the tallest living terrestrial animal and the largest ruminant on Earth. So yes, I believe last time you might have had discussions on the ruminants, but I'm sure you left out the giraffe as one of them. Because of some of its other unique features. It is classified under the family Giraffidae, along with its closest extant relative, which is the okapi. Traditionally, giraffes have been thought to be as one species, that's the Giraffa camelopardalis, with 9 subspecies. But the giraffe's distinguishing characteristics, they are mainly characterized because, they're mainly unique because of one thing is their long neck. They also have very long legs, and they also have the horn-like features that are referred to as the ossicons. And one of the other most common features that actually characterizes them is their skin pattern. Just like the leopard and the cheetahs, the giraffes have their unique kind of patterns. Some have different kind of features. As you can see in that slide, there are some various photos of giraffes, different giraffes that can clearly distinguish one from the other. So currently, we know, previously there were 6 valid species under the giraffe that were previously recorded, but currently are known to be extinct. So this is one of the species that is really facing extinction at a very high rate. Most recently, researchers have proposed dividing these particular species into 4 extant species, and they have now been accepted as of this year by the International Union for Conservation of Nature as 4 species with 7 subspecies. Previously, there were considered to be 9 subspecies, but currently they're recognized as 7 different subspecies. The main The four species that are known currently, and the ones that are recognized by the IUCN, are the Giraffe camelopardalis, the Giraffe reticulata, Giraffe tepelskati, and Giraffe. So those are the four species currently recognized by the IUCN. So this brings us to the question: why should we immobilize these gigantic, these very beautiful animals? Is it a must that we have to immobilize them? Do we have to really physically handle them? So ideally, this should be done for essential purposes, like when you're doing conservation translocations. Sometimes if you're doing reintroductions to areas where they were previously and they have been locally extinct for various reasons, or the other main reason should be ideally for critical medical care. So if they're in need of critical medical care, then that gives us cause to be able to immobilize this animal. The focus must always be on the welfare of the individual animal. So if you're not going to take care of these animals' welfare, then probably it might be better to just let them be. Today, well, the main reasons that we usually do giraffe immobilizations is one, treatment of the sick. If you look at the photo on the right bottom, the right lower section of this the screen, you'll see a giraffe with some kind of skin condition. So these are some of the things that could possibly make you want to immobilize this giraffe so that you can possibly treat it before it gets worse or before it starts spreading a disease to the other giraffes, if not to the other species that are within that locality. The other reason is when there's an injury to this animal, and the injuries could be from various sources. It could be one, the animal maybe fell into a pit or into a hole and had some injuries. So it could be a self-inflicted injury. It could be a human-caused injury, like the photo on the top right, where we have animals getting snared, and we come in and rescue these animals from these life-threatening kind of situations. Another reason, apart from the conservation bit of translocations, we have other reasons for translocations. It's because these animals are sometimes found in some kind of habitat that is rapidly getting degraded, and mostly it could be a cause of the current. We are seeing there's a lot of effects due to climate change. So there are some habitats that are being lost and that were really good habitat for giraffe conservation. In most parts of the world, if not Africa, there's a lot of land use changes. And we are seeing that because the human population is growing at a very fast rate, there's need for food. And most of the land that was previously considered to be wildlife land is currently now under crop cultivation. So we sometimes find ourselves with giraffes in an area that has completely been changed from the forested kind of habitat to a crop cultivated kind of habitat. The other reason is because we want to rescue these animals. The mother might have died from any other cause. Could be a natural cause, could be disease, could be from a poaching incident, and you find that the young one cannot survive on its own in the wild, and we sometimes come and rescue them and take them to rehabilitation centers. Hopefully, sometimes we do rewilding programs for them. The other reason we do immobilize these giraffes is to fit some tracking devices. They could be satellite collars or tags for purposes of monitoring their movements, and it also helps us when doing other management aspects. Like when you're doing some roads, we need to check on which are the areas that the giraffes are crossing. If you're doing power lines, which are the areas that are commonly utilized by the giraffes so that we do not get them entangled in these power lines or we do not cut them completely when doing a road construction from one side of the habitat. So when doing some of these translocations, we need to ensure that the animals have a well-padded kind of container so that they do not injure themselves while on transit. So the trucks should ideally should have a good flow, and also the sides should be well-padded for them to be able to move safely. The pre-anesthetic preparation, when you've decided that you need to actually immobilize these animals. Because we are doing immobilizations for various reasons. One we need to do is to have to plan carefully so that you can minimize the stress and other factors that may result in capture myopathy. So proper planning is very key when it comes to giraffe immobilizations. The other thing is to choose a safe area, free of obstacles. Avoid areas with fences, especially these wire fences, or the steep terrain. So if you find yourself that the animal is in such an area, then it will be better to either postpone that activity. But if it's a critical kind of issue that needs to be addressed immediately, then find ways of moving that animal or trying to push them or drive them to an area that is free of these many obstacles. The other is to coordinate the team by assigning specific roles to the different players within your team. So there'll be maybe the head veterinarian who will be in charge of the team that he'll now coordinate and ask them to be ready to partake on the assignments. The other thing is to conduct procedures in cool conditions. So preferably if you're in control, if it's not an emergency, then try and plan for the activities to be done in the early morning hours, especially for areas like our country where we have very cool morning hours, and then we have very warm ambient temperatures late in the day. So we try to work as early as possible so that we do not make the animals or drive the animals or chase the animals during the hotter periods of the day. Especially for captive animals, if they are those in captivity, and I'm sure because you'll be knowing their feeding regime, if they have been fed, this is the time to try and avoid trying to immobilize these animals. The simple reason is because once they are fully engorged or they're fully fed, there's a high chance of regurgitation, and that poses another risk that we're going to talk about in a few minutes. So how do you get these animals down? How do you get the drug to bring this animal down? In the wild setup, the animals will not wait for you. You cannot really approach them that closely. So we require something to deliver this drug to them. And this is what we're referring to, the remote delivery systems. And for most giraffes in the wild, basically just the giraffes, knowing their skin thickness, you'll be able to only penetrate if you have a long needle, at least 5 centimeters or at least beyond 1.5 inches, because the giraffe coat or the giraffe skin is quite thick. Currently, the remote delivery systems that we use normally for giraffes, in our country, we usually use the Daniject ducting system. I know in parts of South Africa, the most common duct is the new duct that is commonly used. But previously, in the past, we had other kinds of guns. We had the Palmer capsule duct gun, and we also had other gunpowder projectile systems. But currently, the good thing with the Danject and the new duct, these are gas-propelled systems, and we use gas pressurized ducts, and also the gun itself is gas. It uses the CO2 gas to project the dart from the dart gun to the animal. So there are various ways of approaching these animals for darting, and one you can do foot darting. Some animals you can approach as close as 30, 40 meters without them getting spooked, or they do not run away once they see you. especially for most of these animals, the moment they see you, at least they create that kind of eye connection, and they get a bit curious, so they do not run away as fast as you might expect. The other one is to use vehicle darting. Sometimes they are not very friendly with vehicles, so they see a vehicle, they start running, but with time, they also get curious and they want to check exactly what is happening. And that gives you enough time to get the dart into there. In very difficult terrains, then the helicopter comes in very handy. You can now drive these animals to a more open area where you can do the darting from as close as maybe 20 meters from the helicopter. Hand injection is only feasible in those animals that are already trained or they are restrained within a captive facility. So you can use the pulse syringes to do hand injections if you can get as close as possible to that animal. The common kind of drugs that are used for giraffe immobilization in our country, Kenya, we have the access to atropine, that's M99. Sometimes we do use that in combination with azapiron. I know down south we have fentanyl that is also available. And in most cases, a combination of atropine and thianine gives a very good kind of immobilization for these great species. So when you're using atropine, for the young ones, you can use between 4 and 7 milligrams. Sometimes it can be 6 to 10 milligrams, but for the younger ones, you can use that range of dosage. For the adult cows, the females, 10 to 13 milligrams should be able to give a quick knockdown. And for the adult males, 12 to 15 milligrams to do that. When you're looking at long procedures, maybe it's a surgery of some sort that you need to undertake on an animal, then the best drug combination is thianine with medetomidine. And for these drugs, once you get the atropine into the animal, it takes about sometimes between 2 and maybe 10 minutes for the animal to get down. And in most cases, they do not go down on their own. So you need to have personnel who are skilled enough to use ropes to guide the animal down. Once you have the animal down, physical restraint is the mode that is preferred because you need to reverse these agents as fast as possible. So you give an antidote for the atropine, immediately the animal is down. For azapiron, sometimes you might not really require to use azapiron, so it can be left out of the drug combination. But sometimes it can be good, especially if you're doing short translocations of these giraffes. So if you're capturing them and moving them to different sites, it might be important to have that combination within your dart or when you're doing the darting. The choice of areas to be darted, we prefer to get areas that have the large muscle groups, that is the shoulder, the rump, or the neck. The giraffes usually run very fast after darting. Once they feel that pain, they start running, and sometimes they can get exhausted very quickly. And that's why we prefer to use a higher dose than recommended. So we say it's better to overdose a giraffe, and once it's down, then you give the antidote immediately so that you can reverse the negative effects of the immobilization drug. So for giraffes, it's better to overdose than to underdose. When you underdose, they run for too long. They get hypothermia becomes a reality and it becomes difficult to control for the effects of hypothermia. So as I said, if you look at the top, the best areas to do the dart is the areas where we have the large kind of muscles. The thigh is a very good area. If you look at the shoulder, you can see there's a good area where there's good muscle cover. And sometimes we can do immobilizations for fitting tracking devices like the photo at your bottom left, and sometimes it be for treatment, like the bottom right photo. It shows you a giraffe with a penile kind of infection that needs attention. So the use of ropes to guide the animal is very key because of the fall. When the animal falls on its own, it sometimes can fall on the with the head first, and it can lead to other injuries that will require now further attention. Once it's down, you can put a blindfold for it to reduce the effects of stress because of the light, and you can also fit in some earplugs just to reduce the noise that the animal is hearing. Control the head and neck immediately to prevent any trauma. So you need people who are really well trained to do that. People who are experienced in that. And then you can position the animal on the right lateral recumbency, because you say these are ruminants. If you place them on the left lateral recumbency, sometimes it affects the rumen, and you can lead to a bloating situation. So you try and always place the animal on the right lateral recumbency to avoid that. Keep the neck extended and the head to be slightly higher or elevated to maintain, and also to try and maintain the airways as open as you can possibly have them. So try and ensure that both the nostrils are open and accessible to the fresh air. And the neck should be slightly extended so that you can have that clear pathway of the trachea that is open. Maintain ventilation and circulation. So if possible, and you're going to have a long procedure, it's always good to have your oxygen canisters with you so that you can do oxygen supplementation while working with these animals. So when the animal is down, it's always important that you continue monitoring the vital parameters. So you'll keep on checking on various signs. One, you'll keep on checking on the heart rate, because this will tell you a few things. It will tell you the animal is getting light or it's getting too deep, and you need to control for that when the time comes. The respiratory rate is also very key. Just check that the animal is breathing well. The depths of the breaths are deep enough so that you are sure that it's getting enough oxygen into circulation. And always take the body temperature, because once the animal runs for that long, the temperature sometimes shoot beyond the 38, 39 mark, and you really need to get that temperature as back to as normal as possible. So what we do is, if it has done that long, you need to have some cool water to keep on dosing the body so that you can have the temperatures come down to within the normal range. Keep on checking the mucous membranes, check the color. You can also check the capillary refill time. And sometimes when you have the proper guidance to check on other parameters, you can use the pulse oximeter that will give you the specific oxygen levels within circulation. So sometimes you have the machines, it's good to use them so that you can always have the freedom to work with the animal for the period that you have it immobilized. Checking for the anesthetic depth, we can check for that using the palpebral reflex. You can check on the ear twitch, the muscle tone, and even the jaw relaxation. But this is usually when the animal is still under anesthesia, because as I said at the beginning, for giraffes, once it's down, you give the reversal. But sometimes there are cases that need deep sedation once because of the procedure that you're going to undertake on them. Common complications and their management. We have animals going into hypoxia, and that's why it's always important that you have your oxygen canisters with you, so that you can do oxygen supplementation when the animal is down and when your team is working on that animal to be able to maintain the animal in good health throughout the procedure. Hypothermia, I said, most of the biggest causative effect is the running. It runs, and once the animal is down, sometimes because you've taken too long also to give the reversal, the animal does not have the normal kind of cooling mechanism. So you need to give that by using the external kind of forces, that is the cool water, or place the animal in a proper shade if you're going to have it for a longer time when down. Regurgitation is very possible. It happens in many giraffes, especially if you're working with an animal that you did not have the prior history of where it was before the darting. It could be coming from the watering points, or it could have been feeding throughout the period before darting. So you have a full stomach, and you're going to dart this animal. Once it gets down, there's a high possibility that regurgitation is going to happen, and that can easily lead um, to other conditions that you might need to really be careful when attending to that to them. Capture myopathy is a reality, and this can be avoided by reducing the chest time. So we said if you need to work with this animal, if it's not an emergency, then it's better to wait for it to be in a good place so that you can do the darting and have the animal run for as short a time as possible. So early sedation can be used to try and calm the animal. And if you feel the animal has exhausted itself, then we can use IV fluids to try and normalize the blood parameters. Bloating is also possible, and that's why we say it's better to always confirm that the animal is on the right lateral recumbency to avoid a lot of pressure on the rumen. So you can keep on turning the animal if you feel the animal is getting bloated and you're not yet ready to wake it up or to make it walk after the procedure that you're going to undertake. Sudden cardiac arrest. This is also a high possibility. Giraffes sometimes give you no warning. It's very fine, looking very fine 1 minute, and a few seconds later, it's completely gone. And you can almost do nothing to support such an animal. So you have to be very careful when working with giraffes because they are very sensitive, and sometimes they give up very fast. So the use of the antagonists when you're giving the narcotics as the drug of choice for immobilization. If you're using atropine, if you're using thianine, naltrexone is the best reversal drug. It's a full antagonist for this drug of choice. We can also use the prenophin, which is a partial antagonist, but the good thing for species like the giraffes, it almost works like the full antagonist. So allow the giraffe to recover in a quiet, open space if possible. So try to minimize so much interaction with the people around or any external forces that might be in play. So try to have the team lead to control for this. And as I said, a proper blindfold and earplugs sometimes makes the animal more calm, and you can move it for long distances without the animal resorting to fights or that might lead to further injuries. A giraffe's heart generates immense pressure. You can imagine the size of that animal from the heart to the brain, to the head, it's about 2 meters high. So you need a very high pressure for you to get blood to the brain. So these animals, it's usually under high blood pressure. And that's one of the things that you need to factor in when working with these animals. So manage carefully to prevent cerebral hemorrhage. So the way you handle the animal will help you to prevent unforeseen circumstances. So the rapid head positioning, if you change it very fast, you're exposing this animal to the risk of the blood pressure shifts that might interfere with the animal's blood circulation to the brain. The long trachea, you can imagine a 2-meter trachea, and you need the oxygen to go right through that 2-meter pipe to get to the lungs. So there's a space that is actually a high dead space with the risk of hypoventilation. So if the animal is not in its proper physiological state, you might end up with an animal that is getting hypoventilated, running the risk of getting hypoxemia due to that factor. The airway management is very challenging, and always try and ensure that the airways are patent throughout the procedure that you are undertaking. So we say the species, the giraffes, are very prone to hypothermia during the chase or recumbency. So if it's during the ambient temperatures, we say try and ensure that the animal is as cool as possible to retain or to maintain the normal body temperatures. The neck stabilization is essential to prevent vertebral injury. So for as much as possible, try to ensure that the neck is well positioned. The personnel who are handling the neck should be very careful and should be very professional in a way that they do not cause injury to the vertebral column, because that can lead to death of these animals. So giraffes are ruminants. So we say this makes them very prone to regurgitation that can easily result in aspiration pneumonia. So that's why we need to avoid dirtying these animals as soon as they have just left their watering points or their feeding areas. Their long, slender limbs or legs are very prone to injury during controlled or even uncontrolled fall. So after darting, you need to be very careful when you bring them down because the legs can become areas of possible injury. They have a very heavy body compared to the size of the legs. And sometimes if they land badly or if they're kept down too long or in a bad position, then they can lead to muscle damage or even nerve damage that will take a long time to heal. So why do you need to use general anesthesia and why do you need to use the local or regional kind of anesthesia? So for giraffes, because you cannot physically handle them for whatever reasons that you might want to restrain them, so you need to employ general anesthesia. And this can be used for many procedures. It could be for surgery. It could be trying to repair maybe a fracture or some kind of injuries. Or it could be just for the purposes of wanting to translocate these animals from one area to the other. So you need to use the general anesthesia for these kind of operations. And once you've used these anesthetic drugs, then you'll also need to have in mind that you need to have the reversal drugs. So if you're using etophine or difentanyl, then you need to have naltrexone or diprenofine in place. If you're going to use xylazine or medetomidine, then you also need to have the reversals for that. That is either the atipamezole or yohimbine combination in place, so that once you're through with the operation, you can give the reversal agents to be able to have the animal up and running as soon as possible. For local anesthesia, these ones are usually used for minor procedures. So they said once you get the animal the anesthetic drug, once it's down, you give the reversal for the anesthetic drug. But if you're working on a wound area, then you need to control pain in that general area. So you need the local anesthetic. So it could be for basic wound repairs. Sometimes you can have deformed the horns of the ossicles, and you need to do some kind of repairs for that. You can do like a ring block at the base of that ossicle and be able to achieve the local anesthesia. And the commonly used agents are lidocaine or bupivacaine that are commonly available within our local markets. And I'm sure in other areas you can find other products that are in their market. So what are some of the key points for safe giraffe anesthesia? Planning. We cannot be tired of talking about planning, because that is what will give you the success at the end of the day. Control the fall and stabilize the neck. Stroke the head immediately. So once the animal is down, I say that 2-meter neck. If it goes back up and comes back crashing on the ground, it's like throwing somebody up 2 meters and letting them come down on their own. So once the animal is down, try and get to that head as fast as possible so that it does not keep on banging itself on the ground. Position the animal carefully so that you avoid regurgitation, you avoid that risk of aspiration pneumonia. Monitoring has to be continuous. So you need to have somebody who is keenly monitoring the status of this animal while it is down. The other one is to administer the antagonist promptly post the time it gets down. So for the atropine, for the fentanyl, you need to give that antidote immediately the animal is down. These will reverse the effects of the drug and also allow for the animal to regain its normal physiological capabilities. So it can breathe easily, it can breathe well, it can get enough oxygen to the system, and it can also partially have control over its body temperature because now it can get the animal can get the cooling kind of effects. Allow calm and obstacle-free recovery space. So when you're through with the procedure, try and clear the area so that the animal wakes up and does not feel like it's being confined. So give it room for it to walk on its own, and always minimize stress to prevent things like capture myopathy. I'll beg to stop there and open the room for any questions. Thank you very much for listening to my talk.
Thank you so much, Dr. Isaac. It was a really interesting presentation. You know, giraffes are one of the animals that give people a lot of questions. And when I was in first year, there was a meme which was going through on WhatsApp, people joking about how you can do CPR in a giraffe. So thank you so much for covering the giraffes for us. I would like to ask the audience, if you have any questions, please feel free to raise your virtual hand, or you can type it in the chat, then I'll read it for you. In the meantime, I would like to ask, let's say it's the animal is in captivity, do you have a specific time that you have to maybe fast it, not give it water or food before you put it under anesthesia?
If you're going to put it under anesthesia, yes, definitely you need to fast them because of what we just said. If you anesthetize them immediately after they are from feeding, and then you run the risk of regurgitation and possible pneumonia because of the aspiration pneumonia.
Okay. Thank you so much. And I can see John Paul says this was a great presentation from Uganda. Thank you so much. Okay, Mike, there is a question. He has asked a question. John Paul, would you like to unmute and ask your question, or should I read it for you?
Oh, it's well. You can read it for me. It's well.
All right. So John is asking, will fluids or supportive care be administered during the procedure, especially if the giraffe is suspected to be dehydrated or the procedure is prolonged?
Yes, it's advisable that you give the fluids if you feel the giraffe is dehydrated. Sometimes you might know that you already chased this giraffe for a long time, and that's why we were saying it's better to overdose the animal than underdose, because when you underdose, they tend to run for too long, and you run the risk of other complications. So once it's down, it will be advisable to get some fluids in these animals.
Thank you so much. And thank you, John, for the question.